So it's a pleasure to be back for another walk with a doc, a stationary walk with a doc, but hopefully everyone will get out walking again later today. It's a beautiful day out. Um, as a reminder, a lot of the topics and the information that I'm going to be talking about really relate to this central concept that is now called lifestyle medicine, which is a focus in medicine on the evidence behind healthy lifestyles and how much of a role healthy lifestyles can play in improving our health, in preventing disease, and in treating diseases or symptoms that we do already have. So today we're going to focus a bit on the connection between two areas of lifestyle medicine, which is physical activity, where Walk with a Doc is housed, but also on this concept of reducing stress through physical activity. Both of these are two of the 6 pillars of lifestyle medicine that were put out by the American College of Lifestyle Medicine. And just to say it, the other 4 are really essential for a healthy lifestyle, and again, preventing disease and also treating diseases once they're present. But physical activity is I think, a fundamental piece that is worthy of a focus like a Walk with a Doc program. But the stress management is important to highlight as well. And so I'll focus just a little bit on stress management and what we know about stress and how that impacts our way of thinking about ways to reduce stress. The reason that stress is important to talk about is because we all experience stress. So even if you think about getting on time this morning to an appointment or to work, or if you're thinking about driving somewhere and a car cuts in front of you, all of that can be mildly stressful, or even much more stressful if you think about the impacts of the COVID-19 pandemic right now. We all experience stress, and stress comes in a lot of different forms. But the reason it's important that we experience stress is because stress is the way that our body and our mind knows how to respond to a potential threat in the world. And so this evolved many, many, many years ago in the body as a way for us to respond to a stressor, hopefully such that the stressor goes away and that threat to ourselves is conquered. So for example, our predecessors in a jungle or in a cave, if we had an injury or a predator jumped out in front of us, our body would need to respond to escape that threat, or else we would succumb to whatever injury it is or get eaten by the predator. And so the stress response system is activated by the brain and leads to the expression of hormones in the body from the adrenal gland, like cortisol, the stress hormone, so that our body can actually change to deal with the stress in the world. Now, the problem is the stressors that used to be every once in a while, ideally, back in our predecessors' day, I think pale in comparison to the number of stressors that we experience now. So in the 21st century, we experience stress on a daily basis from multiple different areas: physical illnesses, mental illnesses, traumas, financial difficulties, challenges with marriage or divorce, with family members, children. You can add the COVID-19 pandemic on here. I mean, you name it, we deal with it. And over time, what's important to recognize is that the same parts of our brain and the same parts of our body are engaging with these stressors just like our predecessors did, the primates that came before us. We still activate the same parts of our brain. We still activate the cortisol released from our adrenal gland. But instead of a very transient change that allows us to run away from a predator, for example, the changes that take place in the body are very consistent. They're chronic, and in many cases, they lead to the most common diseases that I see as a primary care doctor, and many of you probably have experienced in your life as well. So stress is directly related to chronic diseases such as obesity, high blood pressure, also called hypertension, diabetes mellitus, which is a high level of blood sugars, chronic pain, anxiety, depression, and damaging behaviors like many people know stress eating, stress smoking, stress drinking. Stress really brings out a lot of the behaviors that also contribute to chronic disease. And so when we think about exercise, again, I just want to go back to emphasize that exercise is one way that we can directly bring down stress levels, but also using other forms of stress management helps from a healthy lifestyle perspective. And so the concept that I talk about with a number of my patients is building up different ways to engage in stressful situations such that we can adapt to the world around us. So to activate parts of the brain and the body that ultimately reduce stress's impact in causing chronic diseases and symptoms. And so physical activity, this is just another way to show those pillars I was mentioning before, that physical activity is one of the key ways in which we can become more aware of our stress, but ultimately we can adapt to the stressful situation by returning to a more healthy state. And so when we talk about physical activity, I mentioned this at the last session, I'll probably touch on this every time, just to highlight that there are national recommendations for how much physical activity to get. And this is what promotes health and reduces stress. For aerobic physical activity, which is anything that causes the heart to beat faster, this can be biking, swimming, walking, or even walking a pet, any type of other physical activity or sport, and even activities around the home, like gardening or housework. If the heart rate is getting higher, then that's strengthening the heart and leading to health benefits. And the Center for Disease Control recommends 150 minutes of moderate intensity aerobic activity on a weekly basis. In addition, the recommendations are to get 2 days of muscle strengthening activity. And so Walk with a Doc is a great program in many ways because it is highlighting the importance of this moderate intensity aerobic activity, getting out, walking, increasing the heart rate. And that has a lot of health benefits, but specifically for the talk here today, has a number of benefits on our stress levels. So this is just a couple of slides I'll show, or just a couple of graphs I'll show that emphasize the impact that stress can play on reducing, exercise can play on reducing stress. So this is from the American Psychological Society. It shows that like adults, teens report benefits from stress. And so teens here are listed in these orange bars and adults in these blue bars. And exercise can help people feel good about themselves. It can help people feel in a good mood. And you can see about a third of people benefit from exercise by leading to directly decreased stress. Similarly, if you ask people who engage in sedentary activities, meaning mostly things that require sitting or standing, if they manage their stress, whether they're less likely to say that the technique is effective compared with those who engage in more physically active stress management strategies. So going online, going on the computer, is a sedentary stress management activity. You sit down and you do something. It doesn't really reduce that stress, even though we think checking our email or checking the news or checking Facebook, even though we think that maybe that's a way to just calm down, actually only about a third of people report that it's a stress reducing technique. Similarly, a lot of people end their days by watching TV or putting on a movie as a way to de-stress or calm down. But again, only about a third of people actually report that that is a stress reducing technique. What's interesting is if you look at exercise and the impact that exercise has on reducing stress, actually twice as many people will note that exercise causes a direct stress reduction benefit. So that's all I really wanted to share here, just to kind of paint the picture that when we talk about exercise, we're not just talking about the heart benefits of exercise, that there are lots of benefits to exercise and physical activity in general. One of the key areas that I just shared with you is that stress levels can actually become lower as a result of exercise. And especially now with the pandemic progressing and certainly the second surge taking place with the holidays, the Christmas and end of December and New Year's holidays coming up and Thanksgiving behind us. This is a time where people experience a very high level of stress traditionally. And I think the pandemic and many other economic and political factors are heightening that. And so I just want to emphasize that Walk with a Doc and regular physical activity can be one avenue to think about directly reducing stress levels through physical activity. So I'll pause there and see if there are any questions or any thoughts related to this topic. Yeah, that's a great question. So the research studies generally look at an aggregate of activity, and sometimes they'll look actually at an average of daily activity. The bottom line is what's most important, and this is why the CDC recommends it in this way, is that it's much more about the aggregate. So there's some evidence that suggests more activity every day is better, but it's definitely not to the level where it's clearly markedly better to get 7 days of 25 minutes of activity compared to 2 days of 75 minutes. What I generally recommend to patients, and this is actually where the stress reduction component comes in, is that if exercise is a way in which you can reduce stress, then if you're only exercising 2 days a week to meet your 150-minute category criteria, then you're only getting the stress benefit directly on 2 days of the week. For people who benefit from exercise for a number of reasons, it helps clear the head, reduce stress levels, control appetite, then in that case, it might be more beneficial to spread it out to 5 days. So I generally recommend 5 days of 30 minutes of activity, but it's very much dependent on what is, someone's work schedule, the weather, if they're exercising outside. It depends on a lot of different things.